Hello to all students. In this video lecture, we are going to discuss breast cancer. First of all, I am going to emphasize on what is cancer. As you know that our body is composed of trillions of cells. These cells continuously divides with the help of mitosis. And the process of mitosis is very programmed and very accurate, which is controlled by our body. It happens sometimes that this mechanism of division, this process of division, which is known as mitosis, becomes uncontrolled in the body. And the cells of the body, they start to divide without any control, forming a tumor inside the different parts of the body. Tumors are specialized group of cells which are formed by the multiple division of the body cells. These tumors can be of two types: benign tumors which stay in a place, while malignant tumors are those tumors which can proliferate in different parts of the body. So these tumors are known as cancers. And today we are going to discuss especially breast cancer. So first of all, breast cancer is 99% is present in body of female, but there is 1% chance of getting breast cancer in males. So first of all, we are going to discuss what are the main symptoms of breast cancer. If we look at the symptoms, breast lump. If you look at the diagram of a breast, there is a tumor which can be felt by hand if you examine your breast. This lump is a signal that there is some problem in the breast which can develop into breast cancer. Change in size or shape of the breast. Size will increase or decrease and the shape can vary depending upon the type of cancer, which can helps you to diagnose that you are having a breast cancer. Dimpling in the breast in any part, inverted nipple, peeling or scaling of skin around the nipple, that is a big sign of the breast cancer. Redness, milk rejection, and if the cancer has spread in different parts of the body, bone pains, swollen lymph nodes, shortness of breath, yellow skin, and nipple discharge which can be clear or bloody. So if you observe one or many of these symptoms, that is a sign that you may have a breast cancer. So what you should do, you have to go to a doctor to diagnose it. How are we going to diagnose it? So there are different methods to diagnose breast cancer. First of all, physical exam, which can be done by yourself or by a specialist doctor. If not, then your doctor decided to having a biopsy, tissue biopsy. In this condition, a physician or surgeon removes a piece of tissue from your breast with microneedling, macroneedling or surgery. Then that piece is studied under microscope to observe it, to decide it whether it is a cancerous part or a normal cell. If it doesn't help, then we have to do mammography. During mammography, X-rays are used to get the image of the breasts. MRI can also be, and blood tests are also important during the diagnosis of the breast cancer. So once it is diagnosed, then surgeon or doctor decides which type of cancer is. So there are different types of breast cancer. Number one, angiosarcoma. Sarcoma means cancerous part, tumor. Angio means blood vessels. This type of cancer can be present in the blood vessels present in the breast. Ductal carcinoma in situ. This type of cancer is present in the ducts of present in the breast which transport milk. In situ mean in place, at a certain place, and carcinoma mean cancerous part. Lobular carcinoma in situ. In this type of cancer, cancer is present in the lobules, which are specialized region in the breast which produce milk. Invasive carcinoma. This type of cancer can spread from breast to different neighboring tissues like lymph nodes, breast, and other body parts. Metastatic carcinoma is very severe case in which cancerous cells spread in different parts of the body through blood circulatory system and lymphatic system and make proliferation in different organs of the body, and it is very difficult to treat such type of cancer. So what causes the cancer? So there are different causes which are we have enlisted right over here. Family history. Usually this disease can run in families. If a parents or grandparents having breast cancer, they can transfer their genes into their siblings or into their sons, daughters. Mutation in DNA or genes, which is breast cancer gene 1 and breast cancer gene 2, can lead to breast cancer. Obesity can also lead to breast cancer. Menopause, as you know that this is a condition after 45 years of age in the female body, menstruation stops, and this condition is known as menopause. So during menopause, getting breast cancer chances increases. Oral contraceptives. Too many uses of oral contraceptives, which are birth control pills, can also lead to breast cancer. Dense breast can also have breast cancer, and radiation, which are known as ionization radiation like X-rays, ultraviolet rays from sun or from X-rays from the medical laboratory, can also cause mutations and which can lead to breast cancer. So if you look at this diagram right over here, this is a diagram of a breast which contain fat right over here, and it contain lobules which are milk producing area and the ducts which transport milk into the nipples, and there can be a lump or tumor inside the ducts or lobules which is known as breast cancer. So once the cancer has been diagnosed, then we have to decide at which stage the cancer is. So there are different stages depending upon the type of cancer. So first of all, there is a stage 0 which is known as early stage or non-invasive stage. During this stage, the cancer is present in the local in situ form, which is easy to treat and easy to take care of. At stage 1, the tumor becomes about the size of 2 cm. In stage 2A and 2B, in 2A, the tumor is more than the size of 2 cm but less than 5 cm. And in stage 2B, the tumor is greater than 5 cm. In stage 3A, 3B and stage 3C, the tumor or the cancer become invasive. It is going to spread in different nearby tissues like lymph nodes and other tissues of the body around the breast. And then final stage, which is known as stage 4, which is metastatic stage. In this stage, cancerous cells proliferate and spread in different parts of the body with the help of lymphatic system and blood circulatory system. So this is an advanced stage which is difficult to treat. So once if the cancer has been diagnosed and we have decided at which stage it is, then it is going to be treated by a specialist doctor. So there are different methods through which this cancer can be treated. This is not this can be treatable. I mean, it's curable if you have taken care of and you are taking care of this cancer with specialist panel of the doctors. You can get rid of this cancer very easily. So there are different methods to treat cancer. Number 1, surgery. which is also known as mastectomy. In this method, which has different types, the surgeon is going to remove the part of the cancer from your breast with the help of surgery, and it depends which part of the breast has the cancer and what size of the tumor is. Then surgeon is going to decide then which type of surgery I am going to perform. So there are different types, so I have just mentioned only one. Ionization radiation, high power of X-rays are used to kill the tumor present in ducts or in lobules to kill the cancerous cells. Chemotherapy is usually performed when cancer is at the last stage, metastatic stage, stage 4 stage. When the cancer has spread in whole body, then anti-cancerous medication is inserted through veins in the body to kill the cancer cells, but it has many side effects that is going to be discussed by doctor with you. Hormone therapy, in this certain hormones are injected inside the body which are going to kill the cancerous cells like tamoxifen. Immunotherapy, in this therapy certain medications are administered to make the immune system strong, which is going to then fight with the cancerous cells and kill them. Certain medication like atezolizumab can be used in immunotherapy. There are also some targeted drugs which can also be used to treat cancerous cells. This include abemaciclib, olaparib. So this medication depends on your physician who is taking care of this cancer, that which medication is going to be administered. But anyhow, the cancer anyhow is a very painful and a very serious disease. So we must have to know about it, and we have to do something to prevent it. So what are the preventive measures which can be adopted to prevent breast cancer? Number one, control weight. Maintain an ideal body weight so that the chances of cancer can be reduced. Stay active. Don't sit always all around the time, all the times. Do some work inside the home, cleaning, cooking, etc., which makes you active. So it will helps you to lose weight and makes you healthy. Breastfeeding, if you are a mother, always breastfeed your baby maximum possible days and up to 2.5 years, which will reduce getting their chances of cancer to zero. Limit hormone therapy. If you are taking hormonal therapy in menopause, stop it or limit to minimum this therapy to reduce the chances of getting breast cancer. And get screened every 6 months, every once a year, every once or 2 years to get in touch with your physician or doctor and being tested that you are not getting any kind of breast cancer. So I hope it makes sense, and I'll see you in the next lecture. Until then, bye.